On the Health Watch tonight, there are fears a measles outbreak in Texas will spread to more states, and doctors are telling some Americans they actually need a measles booster shot. Our Marissa Sulek spoke to a local doctor about who could need this extra protection. Marissa.
Yeah, Erica, right now some doctors are saying it's a very specific group who could use a booster. They are people born after 1957 but vaccinated before 1968. They may not have the best immunity from the infection because vaccines at that time were not as effective. How likely will this outbreak spread to Chicago? That's a question we brought to a Northwestern doctor.
He woke up with some spots, as you can see, on his cheeks.
Children and teens in Texas are being hit with the measles after nearly 100 cases were reported nationwide. Health officials say many infected are unvaccinated. After 19 hospitalizations, there is concern the respiratory illness could spread.
Although it is down south and far away, we do know that measles is very contagious.
Dr. Satina Wheat is a family physician with Northwestern Medicine.
It starts off as just like every other virus.
She says the first measles symptoms are typical: fever, runny nose, sore throat, and watery eyes. It progresses to white spots on the mouth and the defining rash on the body. Chicago saw its own outbreak last year. That's when the city had 64 confirmed measles cases. Most were linked to a migrant shelter in the Pilsen neighborhood.
We learned some lessons on how to identify it, on how to get testing taken care of.
Dr. Wheat says the vaccine is highly effective, safe, and most kids get it in 2 doses. The first when they are 12 to 15 months, the second when they are heading off to kindergarten, around 4 to 6 years old.
Though I do still worry about the people who don't have vaccines against this virus.
Dr. Wheat says the highly contagious disease is spreading in Texas because some families live in tight-knit communities and don't want to get the vaccine. She says if you don't know if you were vaccinated, reach out to your doctor.
I'm thankful to say that I have not seen measles. I really hope to keep it that way.
Dr. Wheat says the virus can stay in the air of a room for 2 hours. If you are immunocompromised, doctors say you should not get the vaccine. Those who are pregnant, got another recent vaccine, or are severely ill should wait to get one as well. We're live in the newsroom. Marissa Sulek, CBS News Chicago. Erica.
Thank you, Marissa.